Science isn't just about facts and technology. At its core, science is a process. It's a way of getting from a question to an answer in a logical and repeatable way. You might remember seeing a method or process for scientific problem solving. It lists all the steps that scientists take along the way. Maybe you've tried it before yourself in school. It probably looks something like this. Start by asking a question, then do research. Create a hypothesis. That's your idea about what the answer is. Conduct tests. Then you review the data. Those are your findings. You make conclusions based on this data, and then share everything you found with other scientists and get them to tell you what they think. This is called peer review. Finally, you communicate your steps to the public. You tell them what it is that you found. That is what scientists do. Of course, often, their findings just lead to more questions. So the scientific method isn't exactly a straight line from beginning to end that we just presented. It's more of a cycle. The answers lead to new questions, and scientists revisit the steps as they continue researching, testing, and learning more, all the while getting closer and closer to the truth. This means that scientific advice can change. To learn more about why this happens, we reached out to Dr. Deonandan. He's an epidemiologist, which means he looks at the patterns of disease to understand why and how certain groups of people are getting sick.
An important thing that we have to consider, especially in a public health emergency like COVID-19, is that all of this is true until further notice, because scientists work on the basis of evidence. The more information we get, the more we refine our analysis and conclusions. So don't be surprised if we change our minds. As new information comes in, we should change our minds.
As we go through this pandemic, our knowledge is evolving. Everything from how the virus spreads to who it affects and how. It's all in flux, and this can feel confusing. Remember how at the beginning of all of this we used to wash our groceries? Remember how we weren't allowed to use playground equipment? Well, now we know more, and the scientific advice has changed. And this is normal. This is the way that science works. As scientists learn more about the virus and the disease, there are updates on what the public needs to do to stay safe. We asked Dr. Banerjee to tell us more about this. He's a virologist, which means he studies viruses and the diseases that they cause.
Now, one thing we should understand is we've never lived in a coronavirus pandemic that's been so widespread. So obviously, as the pandemic evolves, the science around it also evolves, and we start identifying more factors that can protect humans. So if you think about why masking was first recommended, and then recommended indoors or recommended outdoors, oftentimes these policies are informed by scientific investigations, and science takes time. So as the science evolves, as investigations come out with results, these results involve policy changes. So if there's a recommendation that's coming out on wearing 3-layered masks or wearing masks indoors versus outdoors, that's based on research and that's based on evidence. So as we live through the pandemic, the science is going to evolve around the recommendations. And the recommendations will only improve to keep you and me safe and protected from COVID-19.
Sometimes it's hard to know what to believe or what to do. Here's Dr. Deonandan again to talk about what types of evidence and sources you can trust.
Has a friend sent you a YouTube clip or an article in the paper or maybe a meme or an experience from an unnamed stranger talking about something relating to science? Maybe they got the COVID vaccine and had a bad reaction, or maybe someone's YouTube clip is talking about some strange theory involving antibodies and how vitamin D can cure all your woes and things like that. Here's the thing. Not all evidence is created equal. Those kinds of reports aren't useless, they're just not as good as other kinds of reports. So we have something called the pyramid of evidence, in which there's low quality evidence at the bottom and high quality evidence at the top. In general, the best evidence is on top and the worst evidence is at the bottom. Here we have the worst quality evidence, which is somebody's opinion, even an expert's opinion. It's not worthless, it's just not particularly fantastic for making decisions. At the very top, we have randomized controlled trials or clinical trials with a placebo group and a drug group. And even above that, we have this thing called meta-analyses or systematic reviews, because even some randomized trials aren't fantastic, so we pick only the best ones and distill the information from those best ones to get us the absolute best evidence. So the bottom line is, recognize that science has a variety of different kinds of evidence, and it matters the quality of evidence that we use to make decisions.
Changing scientific advice is a normal part of the process. Make sure you use the most current science to make your decisions. But you still have to be on the lookout for bad information. It could be old or just wrong. That's called misinformation. Watch out for disinformation too. That's false information that is deliberately spread. Keep the pyramid of evidence in mind while you evaluate what you hear.
As the pandemic evolves, the science is also evolving with it. The science is progressing to identify variants. Science is also catching up on testing the efficacy of these vaccines against emerging variants. So wear your masks, keep your distance, and let science inform the policy.
Together, let's stop the spread of disinformation. Follow the most current scientific advice and trust the process of science. To learn more about how to recognize and combat disinformation, check out the other videos in this series.